Hey there. Welcome to your personalized deep dive. Ever feel like medical technology is one giant mystery?
It can feel that way for sure.
Today, we're lifting the curtain on two big ones, MRI and CT scans.
We're talking magnets, x-rays, and some seriously cool ways of looking inside the human body.
Right, and we've got your research right here. Let me tell you, some of this stuff is fascinating.
Definitely.
By the end of this, you'll be able to impress all your friends with your knowledge of medical imaging.
And more importantly, you'll understand how these scans work and why a doctor might choose one over the other.
Exactly. Because who hasn't wondered what's going on inside that giant donut-shaped machine?
Right.
It's a bit like trying to figure out what's in a present without unwrapping it, right?
I love that analogy. And you're right, both MRI and CT scans give us a peek inside without needing surgery.
Okay.
The fundamental difference is that MRI uses magnets and radio waves. To see those soft parts of your body, think muscles, organs, ligaments. CT scans use X-rays to create images, which are really good for looking at hard structures like bones.
Okay, so MRI is for the squishy stuff, CT is for the bony stuff. So far, so good.
Yeah,
But our research said something about MRI being a better choice for kids sometimes.
that's right. One of the biggest advantages of MRI is that it doesn't use any radiation.
Hmm.
That's a major plus, especially for children who are more sensitive to radiation's potential risks.
That makes a lot of sense. And to be clear, we're not saying CT scans are dangerous, right?
Absolutely not. Both scans are considered safe when used appropriately.
Okay.
But like any medical procedure, doctors weigh the benefits against any potential risks. And radiation is one factor they consider, especially for younger patients.
Okay, so that's one big difference between the two. What else makes them unique?
Well, while MRI excels at showing those soft tissues, it also provides incredible detail. It's like the difference between, standard definition and a high definition television. MRI gives you that sharper, more detailed picture, which can be crucial for certain diagnoses.
So if a doctor needs a really, really clear image, say for something like a very small tumor, they might go with MRI.
Exactly. Our research even mentioned a case where a patient with a suspected brain tumor initially had a CT scan, which didn't show anything conclusive.
Wow. So in that case, choosing the wrong scan could have had some serious consequences.
Absolutely.
Yeah.
That's why understanding the strengths of each scan is so important. Now, going back to that brain tumor example, they followed up with an MRI. And sure enough, they found a very small tumor that was hidden from the CT scan.
Wow. And that's something that they just wouldn't have been able to see with the CT.
Right. It just wasn't detailed enough.
Okay, so that's a pretty powerful argument for MRI. But I imagine all that detail takes time, right?
You're right. One downside of MRI is that it can take a while, sometimes up to an hour or even longer.
Really? Wow.
Remember those powerful magnets we talked about?
Yeah.
They create a magnetic field around your body, and then radio waves are sent in. It's the way these waves interact with your body that allows a computer to create those detailed images. It's a complicated process.
So it's like weaving a tapestry versus taking a quick snapshot.
Right.
Makes sense that it would take longer.
Yeah.
Our research did mention that the MRI machine can get a bit noisy.
Yes. One thing to keep in mind is that those magnets can be quite loud. You'll often be offered earplugs or even headphones with music to help block out the sound.
Oh, really?
Yeah.
I did not know that.
It can be a little intimidating for some people.
Yeah, I bet. Especially if you're already a little bit nervous about getting a scan.
Exactly.
Okay, so to sum things up, MRI, no radiation, super detailed, but might take a while and involve some sound effects.
Right.
CT scan, faster, great for bones, might involve a bit of radiation, and the trade-off there is speed. Did I get that right?
You got it. Now, let's say you are in the doctor's office and they're trying to decide which scan to order.
Okay.
How do they choose?
Yeah, how do they choose?
Well, it all comes down to what they're trying to figure out.
So if it's something like, did I break a bone, they'd probably go with a CT scan.
Exactly. A CT scan would be the way to go, especially if it's an emergency situation where they need an answer quickly.
Yeah, that makes sense.
But if it's a situation where they need a very detailed look at soft tissues, like trying to get a clear picture of a muscle tear or a spinal cord injury, then MRI would be the better option.
It makes sense that doctors consider all these factors when deciding which scan is best. What about us, the patients? What can we do to be prepared? So let's say I'm actually scheduled for one of these scans. What should I expect?
Well, for MRI, the most important thing to remember is that those powerful magnets don't play well with metal.
Okay, so leave the jewelry at home.
Exactly. Anything metallic, from watches and earrings to even things like hairpins or zippers, needs to be removed. Our research actually mentioned a case where someone forgot about a small piercing and had to reschedule their entire MRI.
Oh no, I bet they didn't forget again. Makes sense though, those magnets are serious business. What about CT scans? Anything I should mention to my doctor beforehand?
For CT scans, the main things to tell your doctor are whether you're pregnant or have any allergies, especially to contrast dye.
Contrast dye. What's that?
It's a special substance that can be used during a CT scan. Think of it like a highlighter for your insides. It helps the doctor see things more clearly on the scan.
Oh, okay.
While it's generally safe, it's important to rule out any potential issues beforehand.
Got it. Communication is key. It's great to know I can talk to my doctor about any concerns. This has been a total crash course in MRI and CT scans. I feel like I've learned so much.
It's amazing how much these technologies have revolutionized medicine, and the field is always evolving.
So what's next for medical imaging? Any cool advancements on the horizon?
One area researchers are really excited about is making these scans even more personalized and precise. Imagine scans that are not only tailored to your specific needs, but also potentially faster and even more comfortable.
Wow, that's incredible to think about. Feels like we're really on the frontier of medical technology.
We are. And the more we understand about these technologies, the more empowered we are to make informed decisions about our own health.
Absolutely. So, if you're ever facing a medical situation where an MRI or CT scan is recommended, remember what we've discussed. Ask questions, understand the benefits and limitations, and don't hesitate to speak up. Knowledge is power, especially when it comes to your health.
Well said.
Thank you for joining us on this incredible deep dive into the world of medical imaging. Until next time.